Hey, this is Russ. Time for a patient update. Yeah, we haven't had a patient update lately, so let's go ahead and do that. I think the first update we did was patient 2F from Kansas. Remember her? She was a 72-year-old lady who had her knee done. And she told us that the CBD oils that she was using was not marijuana. Remember that one? Yeah. She reminded me that it's actually from hemp, which is it's cannabis, but it's not like marijuana because it doesn't have THC. THC is the active ingredient that makes marijuana. So you don't get that in hemp-based oils from the cannabis type things that they use. So she gave me some more updates. So I wanted to share these updates with you guys, okay? She watched the video that I did about screaming, okay? And she said that she never screamed or yelled, but she did firmly say, ouch, ouch, stop, you're hurting me, okay? She's just too kind. From me, I would be screaming, all right? And she said the PT was sympathetic, but as the days went on, she kept at it and she kept pushing. She finally said to her, she says, okay, let me read this. She says, "Do you realize there's a person here? I am not just a post-surgical knee replacement. I am me." She's funny. Yeah, so she didn't scream, but she told her off. But she kept pushing. Okay, she says it was like going and being tortured. She says she was once laying down, face down on the table, and her leg would not go down, so it just stuck up. And so there was 2 men and 2 women trying to push it down. Yeah, that does sound like torture. And she wonders how anyone can go without hands-on therapy. Yeah, I wonder that too. Yeah, because I know a lot of people, because of the COVID-19 situations, they're doing telephysio or telephysical therapy, depending on where you're from, right? Anyway, she mentioned about a friend who had hip replacement, and so I said, yeah, I wonder how the hip replacement is. And she told me that she had hip replacement done, all right? She says she gone through both last year, and in her opinion, okay, and I'm reading off screen again here, in her opinion, that both of them are pretty bad. However, the surgery was very bad on the hip, but the physical therapy was worse on the knee. Yeah, I can see that. Okay, because doing the hip surgery is kind of major too. Okay, but yeah, physical therapy on the knee, from what I've heard from others, is worse. Okay. And she says that the surgeon explained from the beginning that the knee was a resurfacing and is closer to the surface, and the knee has more functions. So, but the hip actually goes through more invasive trauma. Yeah, they saw the ball up. Okay, now this is starting to sound a little weird, right? They saw the ball off of your femur by your hip socket, and they have to twist it off. They have to twist it off the pelvis joint and socket, and they ream the bone marrow out some 6 to 8 inches inside of the femur. It's like using a jackhammer, and then they pound the shaft of the implant down into the femur. Now, this doesn't sound too good, right? She saw the video. She says it was amazing but gross. Yeah, I can see that. Now, for me, I can probably handle that. I've seen, autopsies and things like that from the past work I used to do in law enforcement. But yeah, it doesn't sound good, especially when you know that that's going to happen to you. So anyways, these are the updates she has given us. So she had hip surgery done too, but she feels that the knee was worse. Anyway, I just wanted to share that quickie so that you can keep up on her story. We'll have another story soon. Talk to you guys next time.